Hi guys, in this video we're going to give you my best tip for autoimmune conditions, okay? Now, let's talk about what an autoimmune condition really is. It's a situation where your body is making antibodies against itself. It's like the immune system is making a huge mistake. It's attacking the wrong thing. So instead of attacking the microbes, because that's the purpose of the immune system, to protect you against microbial infections, it decided to attack itself. So you can have autoimmune conditions to pretty much anything. Hormones, receptors of hormones, glands, body tissue. There's over 100 autoimmune diseases. Like, for example, Addison's is adrenal. It's a very low adrenal condition where you have antibodies against your own adrenal. MS, that's of the brain. Ankylosing spondylitis, that's antibodies against your ligaments. Lupus, against connective tissue. Hashimoto's, against the thyroid. Rheumatoid arthritis, antibodies that are attacking your own joints and destroying that. Celiac, it's antibodies against your intestines. So you have this constant inflammatory condition going on in your body where the organ or tissue can't heal. It's usually triggered by a stress event. In fact, not usually, it's always triggered by a stress event. If you talk to someone with autoimmune and you ask them when did it start and what happened just before, there will always be either a physical stress or mainly an emotional stress, like a loss. Bam, they just start getting this condition. So it's the immune system that has gone bad. Now, what the treatment usually is steroids, like prednisone. What is a steroid? It's an adrenal hormone. So the actual cause of autoimmune has to be some dysfunction of the adrenal gland itself. So what can you do about this? Dr. Royal Lee, back in the 30s and 40s and 50s, discovered a very unique strategy for autoimmune conditions. And that is this. He found if you took, let's say, for example, you had Addison's and you had antibodies against your own adrenal. If you took glandular adrenals from another species, let's say a cow or a goat or something, and you took this glandular into your stomach, and it went into your stomach, your antibodies that were attacking the adrenal gland would go, what's this? And start attacking the fake or the decoy in the stomach, leaving the adrenal glands alone for a little while. So it gives the adrenals a break to stop the inflammation. So it's a great strategy to redirect these antibodies to a decoy to allow the organ to heal because there's going to be less inflammation. And then over time, if you kept doing this, so over time you can deplete these antibodies to the point where the inflammation will go away and you no longer have any antibodies that are attacking itself. Okay? There's two main points I want to bring up. If you take too much of a similar substance, you can create an immune reaction. And sometimes people think that's a detox reaction when really it's just causing high levels of histamines. Histamines create inflammation. They're like fatigue poisons. So if you take too much, you might wake up feeling a little swollen, a little groggy, a little tired, like you have the flu. That's because it's just creating more of a reaction. So my recommendation is to take very small amounts of the substance over a long period of time and take it before you go to sleep, so that way when you go to sleep, if it makes you a little bit more tired, you won't notice because you're sleeping. Okay? So now, where are you going to get adrenal extract, brain, ligament, connective tissue, etc.? Well, Standard Process is a good company. I don't sell Standard Process. You can find a practitioner or probably go online and find a Standard Process product. If you look at all their products, they have certain products that have certain glandulars in them, and they're very clean. You can also, buy organ meats. You can buy liver. If you have autoimmune to your own liver, you can buy some liver. You can get thyroid extract in certain supplements. You can get adrenal extract in certain supplements. You can get, what about joint? In a previous video that I did on knee pain, I talked about chicken cartilage, right? Well, what do you think you're doing? You're taking that, the body is being distracted, you're depleting your antibodies, and all of a sudden your knees feel better. Well, so it's really not the cartilage, it's just that you're throwing actual chicken cartilage into the stomach and it's being redirected over here. So let's take celiac, for example, of your intestines. Where are you going to get that? Well, when you buy sausage, a lot of times the lining is intestines, chitlins. If you have a little bit of that, they sell that at the store. What will happen, you can deplete your antibodies from that as well. So number one, you want to get an antibody test to find out what tissue is involved in autoimmune. Then take a small amount of that tissue, either in a pill form or in actual food, small amount over a long period of time, and see if it can help you. All right? Thanks for watching. Hi guys. Hey, listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now, and we'll send you a report.